Hello and welcome. You're watching Coronavirus Facts versus Myths. I'm Rishika Barwa. Now, the good news is that India has reported 60,471 new cases in 24 hours. This is the lowest that the country has seen since the 31st of March this year. Now, naturally, since the positivity rate in India is declining and has been below 5% for 8 straight days, restrictions are being lifted in several parts of the country. Is it the best decision? Is the timing of lifting these restrictions correct? Is it too soon? These are questions that are now being asked, especially after the British Prime Minister Boris Johnson has delayed the planned relaxation of coronavirus restrictions in the UK by not 1 but 4 weeks. Now, the UK is going to be taking a decision on lifting its COVID restrictions on the 19th of July. Now, why is the UK doing this? Because of the Delta variant. The Delta variant, remember, is the variant first found here in India. The same Delta variant is the dominant variant in India as well. And according to our own genomic studies, this is the variant that caused the deadly second wave. Now, experts therefore have cautioned against a full reopening in India, as vaccinated percentage of people is very low. There are only 5% of our adult population that has been vaccinated with both doses of the COVID vaccine. Now, here's another important development. Why are both doses important? Because a recent study by Public Health England says 2 doses of the vaccine give a better protection against hospitalization against the Delta variant. The AstraZeneca or the Covishield vaccine here in India gives 92% protection against hospitalization from the Delta variant. The Pfizer gives 96%. But this is 2 doses of the vaccine. That is imperative. So this has, of course, raised questions on whether we're lifting our lockdown all too quickly. Now, to understand what is happening, we have with us a renowned doctor from London and a doctor from Delhi, and we'll try and compare the situations. Dr. Rajay Narayan, Director of the Global Health Alliance, joins us from London. He's a cardiologist with the St. George's Trust in London as well. And we have Dr. Arvinder Soin, Chairman of the Medanta Institute of Liver Transplantation, joining us from Delhi. I want to come to you, Dr. Soin, first. Are you worried about India perhaps unlocking all too quickly at this stage?
Well, I think, Rishika, it's clear that you have to unlock. You can't keep the lockdown on, but it has to be done in stages. And the stages are clearly that you first allow a restricted number from the same household to be seen together outside. So outdoors, you open first, you open public parks, and people are allowed to get together in restricted numbers in gardens and parks. And indoor activities have to be opened more cautiously and later. So the opening or the reopening has to be phased out. That's pretty clear. That's the way UK has been doing it. In fact, the entire world's been doing it. We've also been doing it like that. But in some cases, it seems that more indoor activities allowed than outdoors, especially Delhi, and that is worrying.
Dr. Rajay, if you like to come in here, it's a very different situation that's playing out in the UK. Every country wants to lift COVID-19 restrictions. Every country wants to, bring the economy back on track, especially since cases overall are declining. But in the UK, you're seeing a worrying trend of rise in cases due to the Delta variant. What do you think India needs to learn from the UK or pick from the UK example at the moment?
Yes, I think you're absolutely right, because almost about a couple of weeks ago, we are only having about 2,000 positive cases. And there were a few days when there were no deaths in the UK. But look at what has happened now. In the last 10 days alone, the number of cases have gone up to 8,000. The number of deaths have started climbing up. So I think it is very important that whatever restrictions are lifted, it has to be in a phased manner. It has to be research-based. And that is why the Prime Minister, as you know, from UK has now increased the gap. We were supposed to come out of the lockdown completely last night, but the Prime Minister has increased it by 1 month. Not only that, we know that the number of cases compared to India and UK is extremely less, but still the UK has called in army. They have opened up huge vaccination centers in London, in Manchester, open access centers. You can just walk in and get vaccination done. You don't need to have any appointment. So the vaccination is being further stepped up, especially with the new data coming out last night from the Public Health England, showing so much of effectiveness against COVID, that now that we are trying to vaccinate more and more people, at least with the first dose, we know, because at least the first dose gives you 30 to 40% protection,
Yes.
and now we know it gives up to 92, 96% protection depending on which vaccine you get.
Right. Is that the other cause of concern, Dr. Soin, when it comes to India and unlocking too quickly? Because we have a very small percentage of our total population that's actually got a two-dose protection against this Delta variant, which we know is dominant here in India as well.
Yeah, the low rate of vaccination in India is certainly of concern. We know that the Delta variant has been responsible for the massive second wave that we've had in India. And Delta infections are more severe, Delta variant is more transmissible, and may even escape vaccines, especially one dose. So it's imperative that we speed up our vaccination drive and ensure that everyone gets 2 doses as soon as possible. And that is, yes, another reason why the lockdown has to be even slower and more phased out, because we have the Delta variant, we don't have enough vaccine. And the other thing I'd like to say about opening up of the lockdown is that it's not just enough to say that only 50 or 30% of the workforce should be back in office. You know, the actual proper masking and the social distancing is what needs to be enforced.
Right.
So while there may be an office situation, if you allow 50% of the people to go to work, you may not have enough social distancing. There may be another office where you allow all the workforce to be present, and yet you may have good social distancing.
Right.
So I think enforcing COVID-appropriate behavior is far more important than making these 50%, 30% rules.
All right. You know, I also want to ask at this moment, and it's important that you highlight that, Dr. Rajay, what can individuals do? You know, and what's the sort of advice that you'd like to give our viewers? Offices are opening up, marketplaces are opening up, and some people are going to be expected to go back to work. What's the rule book at a time like this?
I must emphasize that 2021 is not going to be any different from 2020. And what that means, that COVID-appropriate behavior, as Dr. Soin said, is very, very, very important. Till date, we still are using our masks, washing hands, maintaining social distancing, which is very, very important. But I think when it comes to India's perspective, I think if you especially look in the rural areas, I've seen some clips on your television programs, that in rural areas there are vaccination centers where people are not even going to the vaccination centers. So I think it's very important that there has to be a huge awareness campaign, especially in the rural areas of India, where people can go and start taking vaccine, because that is the only thing that we can do to protect ourselves from the virus.
Right. Dr. Soin, do you think that, you know, we need to put vaccination as a criteria for unlocking? You go back to work if you've been given at least a dose of the vaccine. Do you think rules like that need to come into play, or are we still very far away from those situations?
Well, I think that if you ask people to go to work or allow people to come to work only if they've been vaccinated, that would be an ideal situation. But I think we're a bit away from there because we don't have enough vaccines. So as and when we acquire a bigger vaccine stock and are more free with vaccination, like the UK is actually, you know, doing open vaccination. You just walk in, have your vaccine dose. Or if we can actually begin house to house vaccination, you know, you go to the people's doorsteps and start vaccinating. So unless we have that kind of stock, you can't make those rules. But yes, ideally, you should carry a vaccine certificate if you want to get out and be with other people.
Dr. Soin, I also want to ask you very briefly, we've seen pictures of overcrowding at malls in the national capital because malls and shopping complexes are open. We've also seen worrying pictures from vegetable mandis coming in the UK, in Uttar Pradesh, I beg your pardon, where social distancing rules are being flouted. How long before these visuals that we are seeing coming in the last 24 to 48 hours actually translate into a rise in number of cases?
Now, that's a sad statistic that you're asking me to forecast.
But these are worrying pictures, and they're coming in from all over India.
I agree with that. So ideally, this should not happen. I mean, that's why I said that you should open outdoor retail before you open indoor retail. Because, you know, all retail is not the same. I mean, if you've got a street where there are 100 people, that's very different from having 100 people in front of 3 shops in a mall. So you should really be opening out the outdoors, whether it's public places like parks or whether it's retail, before we actually go strong in the malls. In my view, malls are going to be huge super spreader areas, actually.
Right. Dr. Rajay, very quickly on the indoor versus outdoor distinction, do we need to categorize better as India opens up?
I think it's very important, especially in a country like India where the population is huge. India is such a populated country. It's very, very important that we take all the right precaution. And as Dr. Swain said, I've seen some of the clips again on NDTV this morning on the malls in Delhi, where people in hundreds and thousands are just walking around, some of them without masks. So that can be a disaster because we don't want the virus to start spreading again. And as I said, the only way that we can stop is to take lots of precaution.
All right. So phased
Can I add another thing here?
Yes, please. Yes, please.
Yeah. So I was thinking that, perhaps enforcement of COVID appropriate behavior needs to be a little more strict in terms of fining people, in terms of having penalties, whether it's, you catch people without a mask or you catch people crowding together. That kind of thing could come in. Obviously having a requirement for vaccine certificates is a bit far-fetched at the moment.
All right. So vaccine certificates are far-fetched, but fines for not wearing a mask or flouting COVID protocols is something that we can definitely look at. Thank you, doctors, very much for joining us. It's an important story. What is really the right time to open up? No correct answers, no firm answers on that at the moment, but COVID-appropriate behavior absolutely has to be followed. Well, the other big development that we're tracking on the vaccine front is that Novavax has now announced that its COVID-19 vaccine is more than 90% effective, including against the new coronavirus variants of interest as well as the variants of concern. Now, this is an announcement that was made after a large-scale US study that involved 30,000 people in the US and in Mexico. Now, why is this important for India? Because Novavax has a tie-up with the Serum Institute of India. It is once again a vaccine that can be stored at that 2 to 8 degrees Celsius temperature, which makes it viable for India. And what we're also learning is that the company is likely to seek regulatory authorization for emergency use in India sometime around July to September. So how should we be looking at this news? We have Dr. Rajendra K. Dhameja. He is the professor in HOD Neurology, Lady Hardinge Medical College, Delhi. He is also a WHO fellow with the National Institute of Epidemiology. Thanks so much, Dr. Dhameja, for being with us. The Novavax news has created a lot of excitement. This is a company claim at the moment. This data still needs to be peer reviewed. But how are you looking at these developments?
I think this is an exciting news, and we have been waiting for more and more vaccines to come in a big basket of vaccines in near future. So this is a dark horse vaccine, US-based vaccine, and this technology is different from the Covishield or Covaxin because this is a protein subunit like the hepatitis B vaccine. So it's a kind of a directly inoculating spike protein encapsulated in a lipid molecule like a soap molecule, and then the body produces immunity against this spike proteins. So it's quite exciting, and the time-tested technology like hepatitis B. The results you are mentioning are actually in the press release. They have to be yet to be published and peer reviewed. But this is exciting in terms of a large data. So 30,000 people in Mexico and US, mostly in US, 113 sites in US and 6 in Mexico, with over 90% protection against the symptomatic and about 100% protection against the moderate to severe COVID-19 disease. So this actually comes after an initial trial of the same vaccine in UK, which involved 15,000 volunteers in the UK, and that also had around 89% overall efficacy, 83% against the new variant, alpha variant, and the similar kind of against the original one, 96 actually against the original viral strain. So these two trials are very exciting.
Okay, can India actually pin hopes on this vaccine? And if so, what according to you, Dr. Dhameja, is the realistic timeline that we're looking at?
So there are three things to look at. One is that this vaccine is a relatively mild side effects. It is having relatively mild side effects. It means the volunteers which were given this shot had less number of people developing side effects as compared to the other vaccines in terms of numbers. And in terms of people developing infections, there were 77 cases of COVID-19, 63 of them in placebo group.
That's right.
This was a 2-into-1 trial, actually, two parts. The 2:1 means 2/3 of the individuals getting the vaccine and 1/3 getting the placebo.
Right.
So most of them are in the placebo group, 63 of them, and 14 of them in the vaccine group. So the results are very exciting in terms of Indian context. So one is relatively mild side effect. Second is the logistics, because it can be refrigerated up to 6 months.
Yes.
And once you open the vial, it can be used for 24 hours.
Do we have any indication of timeline by the end of the year?
Yes, I think the regulators will have a look at the data. I think the first they will apply to the US regulators, and then obviously at the same time the company is likely to apply to the Indian regulators as well. So within a couple of months, I think we should be ready to have this jab in India also.
All right. Well, thanks for joining us on this very important development. It's exciting news of the promise of yet another vaccine being manufactured here by the Serum Institute. So once again, India, of course, pinning its hope on this new vaccine candidate. We're going to slip into a very short break, but Dr. Dhamija will continue to be live with us on the other side as we answer your questions on the COVID-19 vaccine. Stay with us. Welcome back to our special campaign, Vaccinate India, in partnership with Google. We're discussing any questions you may have about the COVID-19 vaccine. We all take to Google to search for these answers. Today on the broadcast, Dr. Rajendra K. Dhamija, the professor and HOD Neurology of the Lady Hardinge Medical College and WHO Fellow, National Institute of Epidemiology, is with us to answer some of those questions. Dr. Dhamija, the most commonly asked question, concern that still exists is around the safety of the COVID-19 vaccine. What would you like to tell our viewers?
So, Rishika, these vaccines which we are now having, all the 3 vaccines have been tested rigorously. Phase 1 and Phase 2 trials are basically the safety trials and efficacy trials and the dosage trial. So, all the vaccines which are available right now have been tested. They are safe, effective, and now more than 26 crore people have already had the jab. So we know that it is quite safe. Actually, I'm on the committee of adverse event following immunization for COVID-19 vaccines, and we are closely monitoring all the people who have been vaccinated. And so far,
yes,
not many people have got even the minor side effects like redness, pain, local reaction, or mild fever, flu-like illness, which goes away in a couple of days. You don't have to do anything major for that. And I can assure through you that these vaccines have been tested and they are absolutely safe. And we should get the vaccine as soon as possible.
Right. The concern around safety also comes, Dr. Dhamija, because there have been concerns, say, with the AstraZeneca vaccine. There were concerns in Europe about blood clots. What would you like to tell people who are, going to be getting the Covishield vaccine? What are the things that they need to be watchful of after they've been vaccinated?
So there are very few reports of having a clot, particularly cerebral venous sinus thrombosis, but so far we have not come across any such incident in India. So rest assured that these few reports which were reported in US and Europe, they are not yet to be seen in India at all. So obviously people who have a previous history of venous sinus thrombosis or splenic vein thrombosis should be watchful. Otherwise, there is nothing special to be taking any medications or anything like that. So these vaccines can be taken by all, and they have been undergoing different trials now, and we are studying this long-term effects of vaccine, and so far they are absolutely safe, and we should take the vaccine. Whatever vaccine is available, readily, easily, go for it.
Okay, so whatever vaccine is readily available, you should take it. The other question, now that we have a third vaccine candidate being, made available in India, is can I choose my COVID-19 vaccine? Is there a choice when it comes to which vaccine you should take?
So, Rishika, again, we do not recommend any vaccine preferred over the other vaccines. All vaccines are efficacious, effective. In the real world, we have seen that, and all the vaccines are safe. So my advice would be take the vaccine. Taking the vaccine is more important. And now, since we are unlocking and we are just looking at the possibility of a third wave, so the only way to avoid third wave is to maximize the vaccination campaign. And that's what you people are doing it. So try and get the vaccination. Convince people, become vaccine advocate. Try to shell upon the vaccine hesitancy or vaccine reluctancy or vaccine apathy. So we need to be very aggressively take up this campaign so that we can avoid the third wave.
Very important. Dr. Sameja, what advice would you like to give to those who believe that they'd like to wait for, say, a Pfizer vaccine which has a higher efficacy than some of the vaccines that are available in India? Is it worth waiting for a vaccine you may consider to be better?
No, it is not worth waiting for any other vaccine. Whatever vaccine is available, one should take it. You have to weigh the risk versus benefit. It is better to be safe and take vaccine, not to be coming to the hospitalization because of the COVID-19. It is better to save your life because both the vaccines, all the three vaccines now available in India are quite safe and 100% effective against hospitalization and death. So obviously, you cannot take any chance, and risk and benefit ratio is towards the benefit rather than risk of waiting for another vaccine.
Right. But what about people who are immunocompromised? Is there a particular vaccine that they should pick, or for even those who are immunocompromised, they can just go ahead and get themselves vaccinated with whichever one is available?
Yes, at the moment they can go ahead and take the vaccine, whatever is available. The only thing is the vaccines may not be that good effective in those people who are immunocompromised, but all the vaccines are same for that. So obviously there is no vaccine which one is better than the other one, even for the immunocompromised people. So all the vaccines are same. Please go and have the vaccines as early as possible to save your lives.
All right. Well, you heard it from the expert. Go ahead, get the vaccine that is available to you. It will go a long way in saving lives. Thanks so much, Dr. Sameja, for joining us.
Thank you. Thanks for having me.